Today we have with us from Mumbai, Dr. Neeraj Rohida, a young budding orthodontist who has developed a software which is an offline software called DTS PRO. It is basically a digital treatment simulation software, and which is a window based. He would give us some idea about what exactly it is and how it works and how the world is going to change in the near future, because everybody wants to see the way, because generally 70% of the cases in orthodontics are basically cosmetic or aesthetic based. So in all these cases, people would always want to see how would they look post treatment. So we have got a right guy with us today, Dr. Neeraj Rohida. He did his BDS from GDC Mumbai and MDS from GDC Nagpur, and he's into practice since last 10 years. So without wasting much time, over to you, Dr. Neeraj. Thank you for having you here and accepting my invitation to give something, some talk which is absolutely new, and I'm sure that people will learn a lot of things from your talk and your software as well. Over to you. Thank you.
Thank you, sir. Thank you for having me here, and I right away get into the. Just quickly share my screen. Right. So, as sir has already introduced, I am primarily a practicing orthodontist, and I am a clinician. Just before I go into the software per se, I just want to share a small bit on what exactly made us go through this line and try developing a software. So as a clinician in the beginning days, you had patients, say, for example, a patient with a diastema who typically comes across, and the first question that I use, doctor, I want that gap to be closed. And we have three different options. So I am an orthodontist, but of course I do have a general practice as well. So of course there are different ways of managing the same case. So many times patient comes with a preset notion. So for example, I want to do orthodontics, or I want to do veneers, or I want to do composites, for example. Now the question which I came across very frequently is, doctor, can you just show me how will I look after treatment? Right now, this is a question which what typically we do is we just take some models, maybe show some before after pictures from the internet of some cases which we have already treated, right? And we flash it on the screen, or which we use certain, for many of us who still use a pen and a pencil to show how those gaps would close. So there are different ways of communicating with the patient. But then I realized the patients wanted to see how they would look rather than how somebody else is looking after a particular treatment is carried out. So that put us into a, that sort of lit a bulb in our mind, saying that, there should be something which is easy to use by the practicing dentists, orthodontists in particular, to show the patients, convince them, motivate them, even before they say yes to treatment, right? So with that little background, what I would like to show here is do a live demonstration of what my software is all about. It's called DTS Pro. I'm here mainly to talk about the importance of simulations in dentistry, and I will just show you how the whole thing is carried out and the idea of what digital smile designing is all about. I'll be happy to take any questions at the end of the presentation. So this would be around a 10 to 15 minute presentation where I would like to show around how we simulate and show the pre-visualization to a patient, right? This is the software interface, and I have shortlisted a few cases to just put across, and typically orthodontic webinar, right? Okay, so I'll just put up a patient with a diastema, the one I was just talking about. So as you can typically see, such patients would really like to see what different treatment modalities can do to their smile. So what I'm doing is I have just uploaded the patient's extraoral image. In most cases, as a part of the clinical examination, we make sure that we have taken a patient's at least frontal extraoral image and a retracted intraoral image. So that's a normal protocol. Even before the patient has come inside the dental office, we typically follow these guidelines. Now, I use this photograph itself to carry out simulation. So the simulation for orthodontics, I would do somewhat like this, where I would sort of just select that group of teeth and move it as a quadrant, right? Of course, I can do it equally on both the sides, but just to give you an idea and give the patient a preview that if she is looking at diastema closure with orthodontic treatment, this is something what she could end up looking like. Of course, this is a 2D picture, so you cannot take teeth back in a frontal image, but just to give her an idea, the width of the teeth remains the same. Versus if the patient has come with a preset notion of, say, getting additive dentistry, be it bonding, be it veneers, right? So typically what I would do is, instead of moving teeth, I will just select and expand teeth. Of course, I can do it equally on both the sides here. Right? This is something which can be done in real quick time. So I have two simulations ready for the patient to visualize and understand what additive dentistry versus orthodontics would do to his or her smile. And don't you think, rather than showing something to patients, other patient images, patients which we have already done, but the patient cannot really relate to, they would really love to see something happening to their own smile. So the concept of simulations in dentistry was brought by, as everybody is aware of, most of us are aware of, Dr. Christian Kochman, right? He brought the concept of DSD, digital smile designing, where he said that showing patients a pre-visualization on their own smile brings an emotional connect, and which is one of the biggest factors in patients accepting treatment and making the case acceptance to a different level. I actually now believe is in the post-COVID era, where the importance of elective and non-elective treatment, that gap between the elective and non-elective treatment, more so with our field where aesthetics is something which is a part and parcel of most of the treatment protocols that we follow. So that gap is going to widen. I believe patients will come more for elective treatment, and cosmetic treatment, at least for the time being, may take a backseat, where tools like these of patient motivation, so the patient knows, but they are not sure how they would look after treatment. But once they see this picture, once they see something on their own smile, it really motivates them and takes the case acceptance to a different level. So these tools become even more important, I would feel, in the post-COVID era. Let me upload one more image of a patient, similar patient with a diastema, and so these are, I don't want to go and explain about how I'm using the software. I am just selecting the smile area, selecting the lips. So see, being a dentist, I know a dentist would not want to waste a lot of time in using technical softwares. We have got so much things to learn in our own field that we don't want to add to a very cumbersome software that we need to learn, we need to practice day in, day out. That was the primary reason why we wanted to build something which is easy to use, can be done probably in the first visit itself when the patient is sitting in the consultation area, right? So we have these tools where we can easily simulate crown lengthening. For example, what I'm here doing only is shifting the gingiva up in a cervical direction. Many a times only a little bit of crown reshaping. Now, of course, the discussion primarily would be orthodontics, but since this is a software which involves visualizations, and there would be a little overlap of other specialties as well. But yeah, so a little bit of crown lengthening is what I have done here. And then, of course, we can do the same sort of simulation that we had done in the first case. Is I'll just move my segment of teeth to motivate the patient, explain her of how the whole thing can be. So a little bit of gummy smile correction there as well can happen with some amount of crown lengthening on all teeth. It could happen with a little bit of adjunctive treatment at the end of the orthodontic phase, but that can be tackled right in the first visit. So the awareness itself happens in the first visit. As they say, begin with the end in mind. These tools really go a long way in helping us achieve that, right? So something which has helped us simulate the diastema closure with orthodontics, also some amount of crown lengthening. Of course, I have done a little bit of aggressive crown lengthening there, which might not necessarily be done in the clinical situation, but just to give you an idea of what exactly am I trying to project here, right? Okay, now let me upload another image of a patient with crowding. Right, so here is a patient. As you can see, there is crowding in the first quadrant and the other quadrant is more or less fine. So I can just use my simulation tools to simulate crowding correction. What I'm just doing is I'm selecting the interpupillary line so I know where the patient's midline is. These digital tools help us in seeing a lot of parameters which we may not necessarily see 100% in the first visit itself when the patient is sitting in the dental chair. So photographs go a long way in any case to act as a lot of information. They provide us a lot of information with the patient not being in the dental chair. These guidelines would become even more applicable and practical after the dentistry starts back in the post-COVID era, because there's going to be a lot of virtual consultations. There's going to be a lot of online consultations where these tools can be used to actually motivate the patient even without seeing them. So you just have a photograph of a patient, just make some simulation which motivates them in the first phase to come to a dental a practice and start their treatment, right? So we have something called as a mirroring tool here, where we can mirror the normal side and paste it on the other side. So what I'm just doing is I'm copying the normal side and I'm pasting it on the other side. So what this has eventually done is it has just taken teeth from one quadrant and pasted it on the other quadrant. That is something called as a mirror tool, a mirroring function. So again, showing patients something which is possible on their own smile, and at the same time in a very quick way, really goes a long way ahead in patient decision making and case acceptance is what I typically refer to, right? So this is one function of the software. Showing you a similar case again of maybe, okay. Now we can actually measure all these changes that you're doing and also simulate some amount of, I'll just come to that. Okay, so again, here is a case which would need some amount of orthodontic intrusion. You can change the position of each and every tooth. You can virtually check the position of each and every tooth. So I can just select a single tooth, for example. Right. I can see how that rotation would look like. So you can rotate individual teeth. You can select multiple teeth. You can intrude them, extrude them, XYZ. So you can also take a call of how much of intrusion of teeth is possible. What would happen to the smile once you intrude a single tooth, 2 teeth, 3, 4, XYZ. So this also acts as a guideline for the dentist to help in making decisions, and of course for the patients to help them choose the treatment. Now here again, in this case, a case of vertical excess, a case of gummy smile, and there could be multiple options to treat it, orthodontics, non-orthodontics. Again, helps the patient make an informed decision, right? You can select the whole jaw, for example. Let me use a freehand tool. So I will just select my entire upper jaw and I will try to sort of do some amount of intrusion there. Not a lot, some amount of intrusion, right? I can intrude teeth, I can intrude jaw. At the same time, I can use that same extend tool which I showed you in the beginning to just do some correction of the gingiva. What I'm trying to project here is the same thing can be tackled with so many different ways. And if you can show the patient different treatment options on their own smile with different treatment protocols, there is no further motivation tool, no better motivation tool than that. You know, an option for a crown lengthening, you have shown an option for a vertical impaction, you have shown an option for a little bit of dental intrusion, and you can also go a step ahead. These days, there are a lot of lip repositioning procedures. There are fillers and then there are surgeries. You can even tackle that and to an extent show, okay, you could, if you don't want to be too invasive, going ahead with say a surgical intervention, you could probably do some amount of, there would be orthodontic intrusion, some amount of possibly gingivoplasty, and maybe a bit of lip repositioning procedure. So we have got all these planning tools which can be done. So I can just maybe get the lip a little reposition. So what I'm trying to say is all these are digital tools. You cannot show the patients in any other way. You can show the patient, okay, this different photographs. See a photograph for a left foot osteotomy, you can show a photograph for a crown lengthening, but something on their own smile in a most non-invasive manner is where simulation softwares really come into account. I also want to talk here about, since we're talking about simulations in dentistry in general and orthodontics in particular, most of us know Invisalign has got an engine where we can upload the patient's photograph and the engine does the simulation for us. It's based on artificial intelligence, right? I love that engine. I'm inspired by that because it's the quickest way of doing it. So why do you need an additional software for that? With an engine, it only gives you a fixed result. I mean, you cannot change, you cannot whiten teeth, for example, you cannot move each and every teeth. So an engine that definitely goes a long way as far as a quick motivation is concerned. But when you want a little more controlled simulation to be done, for that you definitely need to go ahead with certain softwares. Let me quickly take a couple of questions and then I'll just continue. Severe crowding, yes, I will come to the severe crowding. What about lingually locked bilaterals in which it can be seen in the photograph? Yeah, I will definitely address those questions. Right. So these are tools. Let me come to. Okay. So here is again a case where what happens when there is a severe crowding? There's bilateral crowding, bilateral impacted teeth. There are high placed canines, blocked out teeth. I showed you mirror tool, which can be used in cases where there is a single side which is normal and the other side is the one that is affected. What happens if both sides of teeth are affected or there is severe crowding? In that cases, you can definitely individually select teeth and move them as well. But the other simpler way that we, in such cases, because it is more of a motivation and an initial uh, motivation tool, is we have something called as smile templates. So these templates are nothing but ideal smile images which can be superimposed on the patient's existing smile to create that straight teeth sort of look. So what I'm just doing here is, let me see what would best possibly fit the patient's teeth. So let me just insert this template. Looks very close to the teeth that she has. I can just check the position of the underlying teeth. Looks more or less fine. I can adjust the brightness, contrast of teeth as well. And we are done. So this is something what we call as smile templates. So basically templates are, so in cases where there is an aggressive crowding, right, there are multiple teeth which need correction. In such cases, the easier way to carry out simulation is use one of the ideal templates of different shapes. So for example, this lady has oval shaped teeth. So I choose a template from the oval library and just use it to sort of superimpose on the patient's smile and give that initial motivation. So this is what Invisalign does, right? So again, now speaking about my product here itself, I'm not here for marketing my product. I just want to mainly share what simulations do in dentistry, but we are also coming up with more of an artificial intelligence in the software where basically you can show 20 different smiles to the patient in a single photograph, right? So this is where digital tools are going, and definitely they should be a part of our case presentation and the initial patient consult. Let me check if there are. Can we use in our mobile? No, you cannot use it in the mobile. This is a Windows-based software. And believe me, simulating in a mobile, doing these things on a small screen is an arduous task. This DTS Pro software can also be done on a touch screen, but it's an arduous task. It is always better if you use a mouse. It makes life simple. Can we do surgical simulations with the software? Yes, we can. I'll just come to the surgical thing, and you can even show some lip changes, right? So Let me put a photograph of a patient who would need, say, a class 3 correction. Now, this could be a bi-jaw surgery. This could be a single jaw surgery. So here we can again carry out certain simulations where I will just select my mandible and sort of try to push it back. So this is going to give me and my patient a pre-visualization of how a mandibular setback procedure would look like. And I could even supplement it further by pushing the maxilla a little out, simulating a Lafort osteotomy, and that gives me a quick simulation of how a bi-jaw procedure could eventually turn out to be. We can of course do measurements and check what is the amount of changes that I'm doing here, but this is the initial pre-visualization as we were just discussing about. The same thing can be done the other way around. This is a class 3. A similar simulation I can of course do it on the patient with, say, a class 2 and try and simulate mandibular advancement. So here, instead of selecting my pushing my mandible behind, I will want to just push it in front. So this would simulate something like a class 2 correction for me. So here again a preview where you can sort of show this to the patient. Don't you think this is something which will motivate the patient to undergo whatever treatment you are proposing, rather than the dentist having to put 10 different options? This is something which the patient will sort of relate to. As Dr. Christian Coachman says, it builds an emotional connect when they see it on their own smile. And I want to share a little anecdote here. One of a good orthodontist friends from the US told me he does a lot of online virtual consultations online. So there's this joke going around these days of, since everybody is wearing a mask, who would want to be concerned about their teeth, right? Why would anybody want to do orthodontics or cosmetic treatment in the day when you're putting in the mask and teeth are no longer seen? He related a short incident that a patient came to him requesting to do either veneers or orthodontics, whatever. The reason the patient gives him, I do a lot of Zoom calls, I do a lot of online consults, and I have to spend a lot of time with my team online, and the only thing that is seen on the camera is my teeth and nothing below. So he's not concerned whether he's fat or he's thin or whatever is there below the neck, but they are really concerned about what is seen in the camera. So teeth would probably assume even more significance, I would say, if we are talking more on an online platform. So that was an interesting anecdote shared by one of my colleagues, and I just wanted to put it across to you, right? And you can also carry out the measurement and the calibration tools. So if I have a picture of a patient, an occlusal view, for example, where you want to do the space analysis or carry out certain measurements, you can just do it. So let me, sorry, I don't want to take you to the details of all this here, but what I want to show is you can calibrate the software. By saying calibration, you can just tell the software an actual measurement. Say, for example, the width of the central incisor, for example, is 20 millimeters. I can tell the software that the width of the central incisors in this case is 20 millimeters. Once I have done that, you can carry out measurements the way you want to, and then these will be real-time measurements, right? You can draw in reference lines. You can just place lines anywhere, wherever you want to, and you can measure basically any dimension that you want to once you have calibrated the software. So this can happen when you're doing your crown lengthening, when you want to do your intrusions. You can actually see what is the millimeter of intrusions, extrusions, or your jaw movements that you are looking at. So digital tools give us a lot of information. As they say, photographs really give us a lot of information, and they can actually be used in real day-to-day clinical practice, not only for patient motivation, but for treatment planning as well, right? And I believe these are the primary cases that are related to ortho. Okay, one final application before I then take any further questions. If you have to actually plan using the patients, these days many of us are using intraoral scanners, right, for So you can even overlap the patient's scan on the image and carry out the necessary treatment planning. So let me show you how you can do that. So, okay, so what I'm just trying to do is I've taken the patient's photograph and I'm also taking the patient's scan. So that's the patient's 3D scan which I have. So the software also gives you the flexibility of importing the patient's STL scan, superimposing on the photograph, and then carrying out uh, further changes and seeing how does that reflect on the smile. So I'll just quickly show you how that can be done. So what I'm just doing is selecting the smile area. Um, since the world is moving towards machine learning and artificial intelligence, there are facial recognition system, and I'm very excited and looking forward to our next update, which we're hoping would release within a month's time, where all these steps of the lips being identified, the eyes being identified, the midline being identified will be done by the software itself rather than human intervention. Of course, we will have the flexibility to change the findings, but the software will do most of the things for us. Now here what I can easily do is I can just take my scan and superimpose it on the patient's smile. So you can control the scan in all three planes of space. This is a tool which is routinely used in aesthetic dentistry for designing smiles, for designing veneers. I'm not going to talk about designing veneers because we are primarily looking at orthodontic applications for the software, but yeah, something like that. You can of course change the in all three planes of space. And now once you have superimposed the STL scan on the patient's image, you can carry out whatever changes on that image or on the STL scan and see how it reflects in the smile. So if for example I want to intrude my two teeth, so just imagine I am trying to orthodontically intrude the two of my teeth, I can exactly see the effect that it would do. So, sorry. It shows me the effect that could have on the teeth once I intrude the teeth, or once I intrude the STL scan. Of course, I can go a little more into detail of that, but I don't want to bombard it with a lot of information of how that is to be done. But what I primarily want to project and put across here is you can even use scans and superimpose it on the patient's actual smile and see the changes in 3D that would be happening on the scan. Those same changes can be reflected in the patient's smile photograph as well. So the world is moving towards digital. The world has moved towards digital. It is high time we should start using these digital tools for a patient motivation to start off with, and of course for a lot of digital treatment planning. So these are the primary indications of using a simulation and a treatment planning software. And I am happy to put across my own here, DTS Pro, right? So I'll see if there are any questions and we can take simulation of an orthodontic case, I think. Okay, I have an interesting question and I do come across these questions a lot of times. How do you address the medical equal consequences of the projected simulations as compared to biologic limitation? Because the patient will ask for a pre-treatment simulation and hold you accountable of not giving the promised result. It's a valid question, absolutely valid question. I answer this in two ways. A, whenever we do any sort of simulations, say for example, I'm just trying to upload, let me just quickly do any simulation for that matter. Right, so I maybe do a little bit of whitening for this lady and nothing else. For example, I just whiten her teeth and give her a simulation. I always make sure that there is a disclaimer in every picture that says that this is a simulation and the treatment results may vary. So medically, there is always a clause that tells you that this is a simulation and not an actual treatment projection. Point number two, what do we typically use for patient motivations, right? We show some other patient photographs. Now, the biology that the second patient has may not necessarily be the same of a biology which this particular patient has, right? So if, for example, you have got after 4-4 extraction case, a 6 millimeter of lip fallback in that patient and not necessarily the same in the first patient. The same patient can also bring and tell you the same, that you had shown me that case there where the lips totally went in, my lips did not go in. So eventually simulations are one of the tools which can be used for patient motivation. I say it is a better tool than other tools, primarily because you are showing it to them on their own smiles. Having said that, it is one of the tools which can be used in the entire patient flow journey, right from the initial consultation to the final day of treatment. So, and at least personally, I make sure I show the patient simulations, get the case acceptance, and then finish. I am not going to mail this to the patient, or I am not going to send it to the patient over a WhatsApp. The image is used for patient consultation motivation. Show it to them, get over it, and finish. So that is my policy, my principle. But yeah, I hope I've been able to an extent address that question. So yeah. Yeah, so can we install the software in only one system? So typically we allow you to install it in two systems. So again, I don't want to make this sound as I'm not trying to sell it here or something of that sort, but typically I'm just trying to say, yeah, from a
So, but Dr. Neeraj, you can tell, no problem, because
yeah.
it's all our home crowd, all orthodontists. So there
Right. So we typically give two system licenses. So one license, once you purchase, can be installed. It can be installed in two systems. I will like to share my website also here, where there is the entire detailed information about the software itself. I will just write it down here. So
there is a question from Dr. Vijay M.
yeah,
He's asking, can we outsource this process to you for a fee per patient?
no, we do not want to do that. And the primary reason for that is, it is for me just a photograph editing there, so I might very well use just some smile. I can do it in a minute for you, right? We want the dentist to do this, because the dentist has seen the patient. They understand what is the biology, what is the physiology, what is the mental makeup of the patient. And this
And
is a
what is their
follow-up to the
treatment
question.
plan? Because your treatment plan might vary from the other's treatment plan as well. So it is better that person do it on their own.
So that this was a follow-up to the question asked by Dr. Parekh of the medico-legal implications, right? So I can intrude the teeth, for example, 10 millimeters. The patient would start looking lovely, but the treating dentist knows that 2 millimeters is my limit. It could be an envelope of discrepancy or whatever. So, they would only want to do it that way and tell the patient that this is what is clinically possible and this is what would be the end result, more or less like. If not, we have other treatment options. So, that's the primary reason why we don't want to open it as a simulation service, and we primarily want to focus on the software itself.
Okay, there's a question, one more question which you can answer.
Yeah, the cost of the software, I'll just enter details here. So it's typically what we typically charge is it's a subscription service. We have around 12,000 plus GST for the first year, which comes to roughly around 14,000 rupees, and then annually from the second year onwards it is 3,600 annually. So 3,600 annually is the second year subscription onwards. The main one more very critical reason for developing this software also was to get the software which is affordable by the majority of the dental practitioners here in the country. There are similar platforms available at into 10 the cost, which sometimes may not be the most feasible thing for an Indian scenario. So that was one of our primary products.
Amazing. Like the moment I saw your thing on the first slide itself, I could make out that it is an amazing software. And this is a very indigenous work which you have done. And you must have spent a lot of time, doing a lot of invention into this. And it's so easy and user friendly also. Sometimes we do have a software in a department. We do have Nemosef, we have something else. I do have a personally Dolphin as well, but I'm not criticizing any. Every software is great; they're excellent. But this is so with ease you are doing. Probably it's very simple to do. That's what the ease of doing. The ease factor also matters a lot, because you don't want to spend too much of off chair time as well. Like on chair is fine, but off the chair also you don't want to spend too much of time. And one more question like I have is, can we export this to like a mobile, like patient is sitting there and we can just export it immediately, or we can just export it in email, or what way it can be?
As you can see on the screen right here also, you can export it in the form of a JPEG image, and then of course it can be further sent as on a WhatsApp, or you can directly take a print, for example, right from here, or you can mail it to the patient. You can configure your mailbox. And I personally, as I told you, want to show this on the patient. So simulations typically, again, Dr. Christian Coachman's philosophy is show it to them on a big screen. Simulation is something which is not very well appreciated. I would not say not appreciated, very well appreciated on the mobile screen as opposed to maybe a 40-inch big screen in your consult area. Makes a world of a difference. I show it on a big screen, the image goes into the recycle bin after that. So
and that's what in yesterday's talk we had from iOS. We had Dr. Anmol Kalha. So Kala sir said the same thing, that people are saying that post-COVID we may not have a money to spend so much on this and that, but then he showed very good effect, that is a lipstick effect, where post World War II people were not spending so much of money on the other things or the other essential things, but they, to feel good, they were spending on looking good, because that was the only positive thing that makes them happy. So
right.
Definitely in orthodontics is the way, like if people are thinking that post-COVID we might have a problem, as you said about mask factor, I think mask factor will be masked below the mask.
I'm not concerned what my weight is, but I'm definitely concerned how my teeth look like, right?
Okay. I think any more questions are there? Okay. And what about the braces? Like, can we show?
Yeah. Oh, yeah. We can show. I just missed out on that. That's more of an education tool again, but you can definitely show patient how different type of braces would look on their smile. So typically, what we do is that we just have these little.
Wow.
You can move each and every bracket up or down. You can remove a couple of molar tubes if not needed. I don't want to do it right away. I'm just showing you. So I can show the patient, for example, metal brackets, ceramic, the clear ones, metal self-ligating, ceramic self-ligating. Wow. And you can, of course, edit the brightness.
I can give you something to work upon. Why don't you put a lingual also?
Yeah, so I mean, we have lingual, always a requirement coming in for lingual and for Invisalign and for aligners, right?
Right.
The thing is, for aligners, you have to simulate as if there's some plastic on teeth, which doesn't looks really funny. So
yeah,
we have not.
Anyways, it is the same like what you are wearing. You're not wearing anything.
You're not wearing anything. Absolutely, same for lingual as well, right? So.
Any more questions? I think, yeah.
Invisalign definitely has got a good engine. I mean, so many of us know, many of us are using it, right? So for something which is for a routine case, if you just want to upload a patient's image, it does it automatically for you. So software is definitely, you cannot compare it with the engine. Software gives you much more flexibility, but just since we are talking about simulations in dentistry in general, Invisalign has got a good engine.
Okay. Dr. Naina Patni is asking, do we require to undergo a training after buying it? I think it would be through remote.
Yeah, there are online tutorials available. I would not say you will start using the software the moment you purchase it and start putting in photographs. Anything does have a little bit of learning curve associated along with that. Having said that, if you do it on a couple of cases and know the tools of the software, it is more or less a very easy to use and a quick software.
Okay. Next question is from Dr. Hardik Ajmera. Do we need a RAW file or a JPG can work?
No, JPEG, not a RAW file. JPEG or PNG can definitely work. And whether you take it from an SLR camera or a mobile camera, the software doesn't know from where the image is coming, the source of the image. As long as the image is good, these days mobiles have got good cameras, right? So as long as the image is good, it is not pixelating when you are showing it to the patient on a decently big screen. Doesn't really matter what is the source.
Are you planning to go a 3D any
Yes,
time?
Yes, we are already working on the 3D software.
And would it support that Belusa 3D software?
Yes, so you will be able to import facial scans as well. Yeah, so the facial scans typically are in the format of an OB. So file formats 3D. Typically, we have got the STL format, which most of the scans do. And that's a colorless format, a black and white format. And whenever you have got color, it would be either PLV or it would be OBJ. These are the two typical formats that would come to. So we are trying to incorporate all of this.
I think when you come 3D, I think you will be able to incorporate CBCT data also.
Absolutely, DICOM is one part which can.
Perfect.
But again, since we're talking of 3D, a little bit of extension on that. We are primarily into the aesthetic space in the 3D
I know.
in the beginning, for sure. We want to take the software where you show the patient a simulation. The patient says yes for treatment. Then you go to the next stage where you can actually do a mock-up in the patient's mouth. So it could be veneers, it could be composites. So if you have the scan, you will do the 3D designing, take a tooth library, paste it on the patient's teeth, merge it, export in the form of a new model, print that model, make a pro temp putty index, and then show it to the patient's mouth. So that is where we are headed to, at least in the immediate future. And then eventually, once you are there in the 3D platform and then building surgical guides and building crown lengthening templates, and then eventually aligners is the way any software takes.
Okay, Neeraj, I'm having a candid chat with you here.
Absolutely.
In this platform, and all are our own people. So like, as you have all the angular things with you, right? We had a very nice talk on the same topic, but it was for the simulation of cephalometrics, as well as for the other thing was Dr. Milo Sherrington from Chile, Santiago. Now the thing is, he was doing it, he was doing all cephalometric analysis with the PowerPoint and Keynote. Now your platform has everything. So can we import the cephalogram and do any linear measurement here?
Absolutely. So if your cephalogram can be exported as a JPEG image, right? So instead of putting the retracted image of the patient, so you can put the extraoral profile view of the patient, and you can put a cephalogram as a retracted image, overlap the two, and definitely, yeah, you can definitely do that.
Okay, thank you.
It is not designed primarily for that.
I know.
But I mean, we will not have the tools specifically nomenclatured for that, but it's a similar platform. So it's about making a new sort of a window for it, and the same thing can definitely be done.
Okay. There's a question from Dr. Vijay M. Software backup and tech support.
So basically, backup, everything remains inside your system. So you can export it in the form of either a JPEG or a PNG file that remains within your system, or you can save the whole thing as a project file. So that if the patient comes and then you want to sort of show the whole thing again, so you can save it as a project file. Again, the backup remains in your system for sure. Right. And as far as technical support, yeah, we have a team here which does take care of technical support if there is any issue.
Okay. Dr. Anupam Agarwal is asking, how much predictable the simulations are. It's a subjective thing. Again.
It's an absolute subjective thing. Unless you get down to measurements and each and every tooth, which again, see, the primary role I would still say for a simulation software is the initial patient motivation and case acceptance. Then it depends upon up to our aptitude and everybody uses a digital platform to a different extent. Somebody would measure each and every tooth digitally versus somebody who would just use it as an initial patient education tool. So I would say it's a subjective thing.
And can we use this for storing the data as well?
No. So the data still is saved inside your computer hard drive.
Okay. This would be just a platform.
This would be just a platform to process that data.
Okay. Any further questions are there?
In myofunctional cases, yes, you can definitely simulate the jaw advancement as we saw in a case. Yes, for sure.
Okay. Somebody's from your state of Maharashtra only.
So yeah, we do have a technical team there which does take care of. I'll just share the name of my website. So in case of any questions, you can definitely get in touch there. So,
and somebody is asking, how can this help in teleorthodontics?
Yeah. Yeah, that's the website. Yeah, teleorthodontics, again, these are days where more and more virtual consultations are happening. Though I would say whenever the patient sends you a picture or a photograph on a virtual medium, you can definitely use it to simulate. But I would say still there is a little bit of a limitation there, because patients might just send in a selfie which is taken at not so pleasing angle, and then working around a distorted photograph is more of a time and you might not end up with simulations which can actually convey the message. Rather, they might, so as long as the patients don't know how to take a photograph, many of us dentists struggle with taking good photographs.
True.
So to expect a patient on a virtual platform to just take a selfie and you take, for that, Invisalign engine would work better, I would really think. Because Invisalign engine can make odd photographs look good too.
I know.
So yeah.
Okay. Any further questions are there? Okay. Great. We have one of the panelists here who also use a lot of 3D things, and in fact is a very good friend of mine and was one of the speaker for our webinar as well, Dr. Vaibhav Mishra. He has his own aligner system as well. Vaibhav, it will be great if you can just have few words. Dr. Vaibhav, are you there? I think we're not able to get through him. Okay.
So I have just
no problem.
put in the email and the website name. Just any addition.
Okay. Any further questions? You can just we have a time. You can just raise your hand and you can have one-on-one question with Dr. Neeraj. We'll take another 5-10 minutes. So if you have any questions, anybody having, please raise your hand. And okay, great. Everybody's enjoying it. Thank you. Thank you, Neeraj, for such a lovely talk and giving an insight into your software, which is really very good. And as rightly said by Mr. Modi also, that go vocal for local. And I'm not promoting anything here. I don't have any financial interest. As you also said the same thing. It was on my request only you divulge all the details about financial things. But it is always better to support your colleagues when he's doing something good. So it's an amazing platform, and I would definitely try using it in my own things also. Thank you for sharing. Before we end up, let me just share my tomorrow's webinar details also. Tomorrow we have something for tooth agenesis, where all of us come across something like what to do with a problem that is if you have a congenitally missing lateral incisor. So tomorrow we will have somebody from Italy who's a co-author along with Dr. Bert Melson, and his name is Dr. Robert.
He's from Rivanati, China, Italy, and this is what it will be. Thank you once again, Dr. Neeraj. Meanwhile, let me just check if anybody has come up with any questions.
Thank you, sir, and you're doing a wonderful job getting all stalwarts from across the field. The comfort of the house, so definitely.
I'm trying to be as productive as possible, because this is if we are not doing such things, we might be busy doing either watching a series or watching a TV or sleeping. So it is better to be a productive and learn something like post-COVID, everybody should learn something new in everything. Like there's a famous proverb which my sir always used to tell me, that you should know something about everything. So I'm trying to give some, like everybody something about everything. I don't know, it's up to the person to accept whether they have a capacity to take in or not. But thank you for motivating it. And thanks to my audience that all of them are joining in and making this successful. Right. And I'm sure like people like you who are giving their time and giving a talk and making all the webinars successful. Thank you very much. Thank you, Dr. Neeraj. Stay safe and all the best for your wonderful invention.
Thank you.
Stay blessed.
Thank you. It's a pleasure.
Bye.
Thank you.
Yeah.